Dr. Natalie Marks, and we're here with another quick cup of knowledge. Joining me today is Mary Berg, otherwise known as the Dental Diva. I love it. She's a licensed veterinary technician with a specialty in dentistry and also the CEO and founder of Beyond the Crown Veterinary Education. Thank you so much for joining us.
Thank you for having me.
Absolutely. You've got a lot of experience in a lot of different areas,
Yes,
and we're
yeah.
really excited to hear some of your thoughts for the technicians that are listening on this episode.
Okay.
One of the things that we hear a lot of today from the technical staff is that they really feel underutilized. They feel stifled or plateaued in their
Yes.
position and really don't know where to go. And you've been able to elevate yourself in a lot of different areas. What are some pieces of advice you could give to some of those technicians that are really struggling in that area?
I think, I don't want to ever say anybody has to specialize, because that is, and if you're going to specialize, it really needs to be something you're truly passionate about. Whether it's nutrition, whether it's dentistry, whether it's anesthesia, it has to be something you're truly passionate about. But I think there's the opportunity for all technicians to continue education and to continue to grow within their profession and actually own it. Be the person in that practice who is the one who's going out there and saying, hey, I really want to get some CE on this, and this is something I learned, and bring it back to the practice to try to help improve the overall practice. A lot of times technicians get thrown into positions maybe they're not ready for, or don't have the experience. Say they get thrown into being a tech manager or something like that. If that happens, then go ahead and see if the clinic will help you get the training you need to do an excellent job, or find that training yourself. There's lots of things available on the internet or people that will help you with that.
And education is obviously incredibly important to you.
Yes, I actually teach for a couple technician programs as an adjunct professor, so I work with a couple programs that are online. So I was an online grad back in the day of dial-up, so I've been doing this for a long time. But I think it's possible with the right mindset. The right person can go ahead and get that education. So when I hear on-the-job trained technicians say they can't get the education, there's no reason they can't. There are some really great programs out there. I think there's a way to do that. And I think having that degree in veterinary technology, veterinary nursing, and becoming credentialed is so important to the advancement of your career.
And so for those students in school right now that are going to be graduating and getting licensed, what pieces of advice would you offer them for looking for the right practice or the right setting to be in?
Well, I think they really have to feel comfortable. I would recommend they get a working interview, and maybe even a couple working interviews, just to see if it's a good fit for them. Not every practice is going to be a good fit for everybody. And go in with the attitude that yes, you do have the knowledge, but also go in and be humble and understand that you don't want to step on toes right away or ever, but you want to go in and be the person that's there learning as much as you can, because we've all been there as the new tech. And we want to make sure that we're learning what the practice can do, or what the practice does, how they do things within that practice. But then we can also say, diplomatically, to say, hey, this is something I learned, and can I show you how we do this and how this might improve flow or efficiency or efficacy within the practice.
Those are all great tips. You've also been heavily involved in NAFTA.
Yes, I have.
Which is very important to you as well.
Yes.
There are a lot of people, I think, in both the technician and the veterinarian side who have not been involved, or maybe started to and then dropped out of being involved in organized medicine. Well-being is such a hot topic right now, and really sort of late to the game, because we should have been focusing on this a long time ago, it sounds like. But what kinds of well-being initiatives is NAFTA and just sort of in general the profession trying to move forward with the veterinary technicians?
Well, AVMA has done a wonderful job with their well-being committee, and we didn't really want to reinvent the wheel.
Right.
Okay. So we actually have, our well-being committee has 5 objectives that we're looking at, and it is physical well-being, mental well-being, professional well-being, financial well-being, as well as harassment and dealing with that. So we, within our organization, are putting together within our website. Our members of the committee of the Wellbeing Task Force are actually putting together blogs. All of us have our own areas that we're kind of have a little bit more expertise in, shall we say, than others. And then we are also offering resources for people who may be struggling in all of those areas so that they have the resources to go for. We aren't to be a sounding board. That's not our intention. Ours is a resource for people to go to who need advice or help, but it's not like a Facebook page where people can just vent. It's really, that's not what our design is. Our design is to be a resource, and it actually took us a year from the time of the development of the Wellbeing Task Force before we launched our website. We really wanted to make sure we were had all our T's crossed and I's dotted before we went ahead and made that public.
So if there's a practice out there with a technical staff that really feels just not as, like you're talking about, not as efficient or maybe as educated, or is really wanting to take and elevate their dental practice to the next level, they could reach out to someone like you and have you come in. And what would a program like that look like?
Well, what I do is I find out what they need, and maybe we customize it a little bit for what the clinic needs. I do have some programs that are RACE approved, so they can get RACE approval for both DVMs and technicians. But we kind of customize it, and I'm training their entire staff. Here's one message, and I'm training them on their equipment. So it's going to be what they're going to use every single day. Now, there are occasions where I go in and maybe recommend replacing some equipment or upgrading a little bit. But we talk about how important dental x-rays are for, that's one of my passions, is teaching x-rays. How important dental x-rays are, because that patient can't tell you where it hurts. So learning how to do that without the angst of the godforsaken bisecting angle technique, where we get it and the people are going, oh, this isn't as bad as I thought it was, and teaching them just how to be more efficient in a cleaning procedure, and even just how to talk to clients. Most of us are introverts in this field, and we love animals, but all of those animals have an animal, or has a human attached at the end of the leash, and we have to learn how to talk to them too. So how do we relate to them? How do we give them the information, educate them on how important dentistry is? 95, depending on which survey you read, between 80 to 95% of our patients have dental disease. Unfortunately, only about 14% are receiving care at a veterinary hospital. So that's a huge disconnect.
It is, and that's a great place for technicians to be elevating themselves in practice,
and
right?
it's something we can pretty much take ownership of. Getting the education in there, doing most of the procedures. I'm a fair believer that the veterinarian should be doing the extractions, not the technicians, but that's kind of the standpoint of both the College of Veterinary Dentistry and the Academy of Veterinary Dental Technicians. But they can take ownership of everything else within that, within the dental operatory, and it can be something we can truly own.
And it's something we're always going to see, right?
Yes.
And
yes.
can start.
And it's not a one and done.
That's
we do
right.
that more than once. And a lot of clinics are losing income from spay and neuters, or pharmacy for that matter. Humane societies or rescue groups are doing the spay and neuters. So this is a way for clinics to go ahead and replace that lost income. Because as I said, 80% of the patients walking in the door have disease, and we need to be treating it much earlier. So it is truly preventative and not waiting until the animal is losing, half its teeth in a procedure.
Right. Well, you're a wealth of knowledge.
Thank you.
It's been a pleasure being next to the Dental Diva. I think I've never been able to say that before, and I will take that with me. But in very seriousness, I really appreciate your time and all that you have to offer to the industry. Wish you the best at this conference and in life, and thank you again for joining us.
All right. Thank you very much for having me. Appreciate it.